I'm so nervous being here. My friend Agnes is waiting outside for me, and she's the one who brought me in, and I didn't want to come, but she said it was a really good idea because, well, I've tried other things, and she said it was a good idea. She's been here before, and anyway, she brought me in.
I can understand that you're nervous about it. Most people who come in here are nervous about it.
Well, yeah, I'm not crazy. That's the thing. I just want to tell you that I'm not crazy.
I know that. But here I am, somebody you've never talked to before, and you're coming in, and presumably you're going to tell me something about yourself that is bothering you. And
well,
of course you're going to be nervous about that.
Agnes thought I should come. Because sometimes I get funny when I go out. I get really funny. I get into the store or something, and I think, oh, God, I got to get out of here. I can't stand
Before we get into the problem, I need to have your name, or I would like to have your name.
Why do you have to have my name? Does that...
Well, I'll tell you, the way this place works is I'm here now. I'm here today. Tomorrow I might not be, somebody else might be here, or it might be Thanksgiving morning or Christmas Eve or Friday night or some other time when someone else is here. And I would like to be able to have your name, make a brief summary of what the problem is, and file it over there. So if you need to talk to somebody and I'm not here, they'll be able to go to the file, pull it out, and see what the problem is.
Was my husband going to hear about this? I mean, you can tell my husband or anything?
Absolutely not. There's confidentiality laws in the state that protect that. It doesn't go outside of the file. It wouldn't do any good if we were going out the minute you told us what was your problem and telling everybody in town. That wouldn't do you any good, would it?
Okay. No.
So,
I guess it wouldn't, but I'm just nervous that my husband will find out.
Sure. I would be nervous too.
Well,
why are you nervous about that, though?
Well, because he says I'm crazy. He said I'm crazy. Nobody has this problem but me. He said no. He said, hey, you're just being silly, Agnes. That's what he says to me. My name's Agnes, I guess you know. He says you're just being silly. He said, you don't need to do this, Agnes. You're just being silly. Now down, he says. And that doesn't help, he says, so. See, look, I'm shaking. It's terrible.
Well, what are you feeling like when he's saying this to you? I mean...
I don't think he's a very considerate person when he says things like that.
But what are you feeling?
I feel bad. I don't think it's fair. See, how does he know what I feel like? I don't think he can possibly know what I feel like. Nobody can know what somebody else feels.
That's true, but give me an idea. You know what you feel like.
He
give me an idea.
Oh, cut it out. Everything's going to be okay. There's no problem with this at all. He said, you just stop it. You're just being silly. And he said that I'm being neurotic. It's a very fancy word, I think, being neurotic. Not neurotic.
And that makes you feel even worse.
Yes. I mean,
how are you feeling like when he says this? I mean, how do you know that you're being, as he puts it, neurotic? How does he know?
I don't think he knows anything.
Well, what are you doing? What's your behavior like?
Oh, I see what you mean. Like, what? Oh, I got these heart palpitations. Boom, 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 boom. And sometimes I just break out and sweat all over. It's terrible. Just awful.
Okay. How long have you been having these?
Throw up or faint or something.
How long?
2 years now. It's been 2 years now. Getting worse.
And how old are you?
I'm 50 years old.
Okay. Going to give me your name. Your name is Agnes.
Agnes Hughes is my name.
That's good. So you're 50 old and you've been having this problem for 2 years.
Yeah.
Not before that.
Yeah. You know, that just shows you how nervous I am. My name isn't Agnes Hughes at all. My name is Edith. God, I'm going crazy. I am going crazy. Maybe my husband's right. Maybe I am going crazy. My name is Edith. My friend is Agnes. I am Edith.
Okay.
Oh,
would you rather give me kind of an anonymous name, perhaps, one that I could identify you by and that isn't your actual name? Would you feel more comfortable?
That's all right.
Some people feel that way.
No, Agnes says you're okay.
So it's Edith now?
It's really Edith. Agnes is my friend. I am going crazy,
Okay. You're going crazy?
Well, my husband says I'm going crazy. I just call myself Agnes and Miss Edith.
Okay. Have you ever spoken to anybody besides your husband about how you're feeling?
Just my friend. I tried my minister, and he said, just pray.
Huh?
He said, just pray. It doesn't work to just pray. I've tried praying. It doesn't work to just pray.
Well, what are you trying to change? This feeling of your heart palpitating and that sort of thing? Is that what you're trying to change?
Well, I don't feel good. I feel like I may just faint or throw up.
And all the time? Part of the time?
Only part of the time. Usually places, but sometimes it's small. Sometimes when I'm at home I feel like that, but usually it's when I go out, big places, like the Gemco, Kmart or something.
Okay, let's take Gemco. You're in Gemco.
Right.
And you start feeling this way.
Right.
Your heart starts beating and you feel it in your chest and
yes.
something, adrenaline pours into your stomach.
I feel icky, like you're going to throw up or something. And it's just really uncomfortable. And I want to get out. I just want to get out. I want to get out right now. I'm not waiting. I want to get my groceries. I don't want to get anything. I just want to leave. And he said, that's just silly, Edith.
Okay, so you turn to your husband for support at this point, and you
And he
get
says
that.
it's silly. He says it's silly and he doesn't understand. And he says it's a really bad example for the children. You're just being silly. You're just going to make them
Is your husband a pretty strong type of person, successful, doesn't show this very much?
Well, I guess you'd say that.
Could it be that maybe he just doesn't know what to tell you?
Well, it could be that, but
And when he doesn't know what to tell you, he gets kind of critical, or he makes a joke of it. When he doesn't know what to say, that's kind of his approach.
I never even thought of that. I never thought that was the reason. I just thought he was just not being very nice. That never occurred to me.
Do you get angry at him then as a result? And does that last with you? Do you go home feeling angry that your husband hasn't supported you and wish he would and wish he could solve this problem for you or help you with it? Or
Yeah, but he doesn't support me about other things either. He doesn't support me about other things either.
what sorts of things doesn't he support you about?
Well, I want to go work now. I mean, he hasn't always had a full-time job, and times are hard, and we've got 2 kids, and things are getting more expensive all the time, and I wanted to go to work, and he said, no, you shouldn't do that. You should stay home with the kids. This is an important age. Does all of those kinds of things, and he said, no, I shouldn't do that. But you know what? I'm bored. They're gone all day long. And how much coffee can you drink?
And how many programs can you watch on TV? Sure.
And I don't like those soap operas. I don't think they're very nice.
You don't?
No, I don't think they're nice. They show a lot of dirty stuff on TV now. So I don't like to do that.
So here you are wanting to get out of the house, wanting to what? Realize your potential, I think that's what it's called.
What does that mean, realize your potential?
Wanting to do something, wanting to be occupied. Here you have been a mother and a housekeeper, is that it, basically?
Yeah, I've been
And you want a change.
Yeah, I do. I want to go out. It sounds goofy, I know, because I say I want to go out, and then I go out and I get a crazy place. I don't know.
Doesn't sound goofy to me.
Doesn't it?
No.
Well, I wonder why he objects so much.
Well, it sounds to me like it's different. How long have you been married? You didn't talk about that, I don't think.
20 years. This is my second marriage.
Second marriage?
Yeah. My first husband died of cancer. It wasn't very nice.
I don't imagine. How long did the first marriage last?
5 years. 5 years. It wasn't very nice. This is his brother, by the way. I married his brother. I'm afraid he might die of cancer, too.
So you're under constant stress from that. What about the kids? So you got teenagers. Those are the problem years. Are they the problem years for you? For your kids?
Yeah, I think so. The older boy has a hard time in school. He sometimes cuts class and stuff. And
He's been in trouble with the something like that?
No, he has. I think he could. I think he could. He's not a bad. He's like my husband. He's not a bad boy.
Nobody's bad. We're not talking about bad. It's just
okay.
He does have some difficulties and some problems, the oldest boy.
Yeah. Sometimes he goes drinking with his friends, too. That's why I don't like it when my husband drinks.
So here's added pressure on you. I mean, there's the situation that you have. There's the relationship between you and your husband, which in a lot of ways is good. Let's talk a little bit about those. Now, what do you like about your husband? And, what do you like about the marriage?
Well, we do a lot of things together. We do a lot of things together. We go camping and...
You enjoy that?
Yeah.
So you and he enjoy a lot of things together. There are some good times.
Yeah, but you know, you forget about those sometimes when things
Sure.
get bad.
Sure. Sure.
And I don't get to feeling sick or anything when we're like camping.
Mm-hmm.
I don't feel like that then.
When you're out there, away from people, away from any kind of scrutiny,
Right.
You're relaxed.
What's scrutiny mean?
People looking at you.
Oh.
Do
Yeah.
you ever think that people look a lot at you or are thinking ill of you?
No, except my mother-in-law and everybody feels
Yeah,
like
right.
that.
I've got the same problems.
Yeah, no, we got nice people around. We have nice people around.
Although, you know, when I'm thinking about your mother-in-law, this is your mother-in-law times 2, isn't it?
Yeah, I never thought of that either. That's right. So I got double trouble, huh?
You could. Depends on what happened in the first marriage. Maybe she felt that you let your first husband down in some way or didn't support him during the illness. Was it a prolonged illness?
5 years.
Yeah.
It was almost right after we got married. It's really funny.
Yeah.
Well, I mean, I don't mean funny.
Mm-hmm. Strange.
I just mean, yeah.
Mm-hmm.
Yeah. But sometimes I just don't know what I'm going to do with myself.
I think what you need to do is probably start into some sort of therapy and explore the problem further. You know, explore the way you feel, explore all the different situations in your life, the dynamics of those situations. Would you be willing to do that?
I'd be willing to do it, but I know what my husband would say.
I'm sure. It's in a way, it's good that you know what he'd say. You'd be prepared for it.
I never thought of that either.
So you can go home and say, I know what you're going to say, but I think I'm going to try this just a little bit to see if it helps me some, and if it does, maybe you can take part in it.
Well, if I get one of these kind of funny feelings, can I call or do something when I tell him?
Of course. You're talking about call the crisis clinic?
Uh-huh.
That's right. It's here all the time.
Kathy, that was a very outstanding demonstration. I really enjoyed that. Maybe we can do something else in another area of the health department over there, mental health department in the future. We've covered the children's services, now the crisis clinic. I'd like to see maybe the outpatient services. Wouldn't that be something we could do?
I think I arranged.
Great.
Maybe something in the day treatment program.
Oh, great. Why did the mental health services or mental health department here in Sutter County and Yuba County, it's a combined county effort, decide to offer the service of the crisis clinic?
Well, in this community and most communities we know, there's 24-hour emergency care for people physically. So why not have 24-hour emergency care for people's emotional problems and troubles? And we have found that people who have emotional problems don't schedule them between 9 and 5. Oftentimes, our busiest hours are in the evening. And that's when most traditional clinics are closed.
True.
So we decided that we could offer this 24 hours around the clock and give people a chance to go someplace for treatment for their emotional upsets and their domestic problems or whatever.
What's the training involved in becoming a crisis counselor?
We have a variety of backgrounds. We have social workers, we have people with master's degrees in counseling, we have, we aren't locked into any background. It has to be somebody who's got counseling background, but who can reach people and work with people and relate well to people. So I have trained housewives to work as crisis counselors very successfully.
That's very interesting. And everything is kept on a very professional basis. And your people have mentioned several times that everything is strictly confidential. Is that always true?
That's always true. I've had a lady come in and be very distraught and very upset talking about her family upsets, difficulty with her husband. And the husband has called while she's sitting there because he's concerned. She ran out of the house. I can't, without her permission, tell him, yes, she's here in the crisis clinic right now.
Interesting.
There are several areas. are not confidential, and that is if someone comes in and talks about child abuse, that has to be reported.
State law says you have to report that, don't you?
Absolutely.
Yes.
Or if somebody comes in and is threatening somebody else's life, that's not kept confidential. There are laws
I'd hope not.
there are laws that say we must take action.
Do people actually have to give their names?
No. No.
So they can come in and say, I just don't want to tell you who I am, but I want to make this and get some help here.
That's right. We don't push for names. People call over the telephone and we let them remain as anonymous as they like, or they can use a fictitious name. Most people don't mind giving their names.
Right. Do you ever see people who might be violent, who are on the verge of violent behavior?
Yes, we do. We do. A lot of people are brought in out of control by the police.
Oh, so people don't just walk in on their own. Sometimes they're brought in even though they don't want to be brought in.
Correct. Correct.
Huh.
We do a lot of work with all the police agencies here. We work with Sutter County and Yuba County Sheriff's Departments and the police departments of both communities and the Highway Patrol.
Is there a situation where people may be asked to stay in the health facility over at Sutter-Yuba Health Services?
Yes, the crisis clinic staff does all the screening for people who need to be hospitalized. And if someone is a danger to themselves or gravely disabled, we can detain them on a 72-hour hold.
If a person has to stay, how long would a usual stay be at the department?
I would say about 3 days.
But we should emphasize that most people who go to the crisis clinic do not become inpatients. They just go in there for 20, 30 minutes and talk things over.
Correct. We have an 18-bed inpatient unit, and we see 1,000 people a month. So,
right. So we just want people to realize that when they walk there, they're not going to be locked in the doors and have to stay in the hospital. That just isn't true.
That's what crisis intervention is all about, to have to prevent hospitalization.
Could you review the phone number again that people could call up to speak to a counselor or to just get more information about the crisis clinic?
Yes, it's 673-8255 or 673-TALK.
673-TALK.
Correct.
Sounds like those radio stations in San Francisco that put talk after their numbers.
Well, there is one of those, and I've had people call and say, are we on the radio?
That's funny. Kathy, I'm sorry our time's about up. I'd like to thank you for taking time out of your busy schedule over at the Crisis Clinic so that you could join us on the Medical Explorer. I know that my viewers and I learned quite a bit about your valuable services at the Crisis Clinic, and thanks again.
My pleasure.
Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see on this program. The Medical Explorer, as you know, is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin Disease and Allergy Medical Group of Yuba City at 367 Del Norte Avenue, 95991. In my next program, The Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices right here in the Yuba City, Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.